Congenital adrenal hyperplasia. Background information. CAH is a genetic condition causing swelling of the adrenal glands. This condition makes decrease in the blood level of the stress hormone and an increase in the level of male and female sex hormones. Some people get a slight condition that produces no symptoms, while others develop a bad form of this condition that can be life-threatening.
Alright, so you're wearing a pretty necklace, and you take a little pill 3 times a day. But why do you actually do that? You have to do this because your adrenal glands are sick. Your adrenal glands are inside your body. Look, there they are. Usually, they make very important things for your body that give you energy. But because your adrenal glands are sick, you don't make any of those important things anymore. That's why we put those important things into a little pill, so you get all the energy you need to go out and play. But sometimes, something really exciting happens, and you get butterflies in your stomach. You know, your birthday is coming up, you're going on a holiday, or maybe you have a fever. Then your body needs a lot more energy, and you have to take extra pills. Because if you don't, you get nauseous, dizzy, and you could get very sick. And you don't want that, of course. And your necklace, you always have to wear it, so that everyone knows your adrenal glands are sick. And if something goes wrong when your mummy and daddy aren't around, other people also know that you need more of those little pills.
Causes. These glands make hormones, cortisol and aldosterone, which are needed for life. But people with CAH lack an enzyme that the adrenal gland needs to make the hormones, in which the body produces more of male and female sex hormone. This causes male characteristics to appear early.
The adrenal glands, located on the superior aspect of the kidneys, are responsible for the release of several hormones. The adrenal medulla, or inner portion, secretes epinephrine and norepinephrine into the bloodstream in response to stimulation by the sympathetic nervous system to produce the body's fight or flight response. The adrenal cortex secretes glucocorticoids that respond to stress by increasing blood glucose. It also releases mineralocorticoids that maintain electrolyte balance by acting on the kidneys. The innermost layer of the adrenal cortex secretes small amounts of sex hormones that resemble testosterone.
Definitions. Cortisol is a principal glucocorticoid produced by the zone fasciculata of the adrenal cortex. It promotes gluconeogenesis and lipolysis, suppresses protein synthesis, inhibits inflammatory and immune responses, and has a mineralocorticoid effect. Aldosterone, a hormone produced by the outer portion of the adrenal gland. Aldosterone regulates the balance of water and electrolytes in the body, encouraging the kidney to excrete potassium into the urine and retain sodium, thereby retaining water. Pros and cons. Pros. Treatment available. Easy diagnosis. People can inject themselves their medications. Cons. Excessive facial hair growth. Inability to menstruate. Enlarged clitoris or penis. Need to take drugs for the rest of life. Mainly affects kids.
The production of adrenal androgens increases prior to and during early puberty, and these adrenal androgens are responsible for a number of changes observed in early puberty, such as the growth of hair, the change in the secretion of the apocrine sweat glands to produce body odor, the growth spurt, and other changes. Adrenal androgens are also known to have effects on the brain, like all androgens, increasing a variety of parameters, including influencing aggression and sex drive. A number of studies have been performed in individuals who have abnormally high secretion of adrenal androgens, known as CAH, or congenital adrenal hyperplasia. While the effects in males, both human and in animal studies, is inconclusive, the effects in females often conclude that there is a masculinizing effect of an overproduction of these adrenal androgens, both in physical appearance and also when a number of aspects of behavior, moods, and drives are studied. And so in the development of somatic gender and brain gender, an overproduction of adrenal androgens in females seems to cause at least some masculinizing effects which would otherwise not have been observed.
Application in medicine. The brain controls the main center and sends signals to the adrenal gland to start producing cortisol. Then, after the cortisol is sent to the receptor sends signals back to the brain. The brain in which tells the adrenal gland to stop or to continue to produce the hormone. Treatment. Get the hormone levels to normal or close normal as possible. Take a form of cortisol 3 times per day. People may need extra doses of medicine during times of stress, such as a bad illness or surgery.
My name is Tracy Schaefer. I'm a registered nurse and I run the Succeed Clinic here at OU Medical Center. My job is education, follow-up, making sure that you have what you need to take care of your kid. So what I'm going to talk about today is how to give the emergency Solu-Cortef injection for patients with CAH. The Solu-Cortef injection should be given anytime the patient can't take their medication by mouth. It's the same medication as the Cortef, just a different way of giving it. So if the patient is vomiting and can't keep down their oral stress dose, that's when they get the injection. If they were unconscious and couldn't take their pill, they would need the injection of Solu-Cortef. So it's just any time they can't keep down an oral stress dose. The items that should be in your emergency kit are the Solu-Cortef vial for injection, the needle and syringe, an alcohol swab, cotton ball, and Band-Aid. The first step is to activate your Solu-Cortef vial. To activate the vial, place it on a firm flat surface and push down on the lid hard. You have to dislodge the orange stopper down into the bottom of the vial. Next, you have to shake the vial around to dissolve all the medication. Your goal is to have no lumps. You want all the powder to be dissolved. The next step is to draw up the medication. The center part of the lid, the small circle, pops out. Don't try to remove the whole lid. Next, you take your syringe and needle. Draw up air in the amount of medication that you'll be giving, either half a cc, 1 cc, or 2 cc's. Remove the cap from the needle. Stick the needle into the center of the stopper. Turn the vial upside down. Inject the air and draw back the medication. It's okay if there are some air bubbles, we'll get those out later. Pull back a little further than what you need and remove the needle from the vial. To remove air from the syringe, you can flick it till the bubbles come to the top, then pull back a little bit, you'll see the fluid line, and push up on the plunger until you have a drop of fluid at the tip of your needle. And go ahead and put the cap back on, we're going to get the patient ready. The Solu-Cortef injection goes into the large muscle on top of the leg. So you want to go the middle third this way and the middle third this way. If the leg was a tic-tac-toe board, you want to be in the middle square. This is our fake leg. So we're going to take the alcohol swab and clean the area. For this type of injection, you have to stretch the skin out tight. You want to be sure that the medication goes into the muscle. So remove the cap from the needle, hold the needle like a dart, stretch the skin out with your other hand, and inject quickly. If you go slower, they just feel it more. Inject the medication, pull the needle out, use your cotton ball just in case there's any bleeding, and apply the Band-Aid.
Give me $100, you can take it out the door. Beginner's love, not just for children. Beginner's love, young and old. Beginner's love.
Issued in Ecuador, Ecuadorian National System of Health. Recommendations and scientific evidence for doctors and patients in making decisions about diagnosis.
Congenital adrenal hyperplasia, or CAH, is a genetic disease of the adrenal glands. In its severe form, it is a life-threatening disease that can result in disability or death if not diagnosed in the first few days of life. Children with severe CAH face numerous challenges and require lifelong medical management. Even in its milder forms, the disease can create serious quality of life issues. Affecting as many as 1 in 100 people, it can lead to early puberty, shortened stature, and even infertility.
We first learned of CAH when our son, Kevin, was brought into Jersey Shore Trauma Unit. He was severely ill. They couldn't figure out what was wrong with him. He spent 6 weeks in intensive care, and they finally diagnosed him with CAH.
Congenital adrenal hyperplasia, also known as CAH, is an inherited disease that affects adrenal gland function. The adrenal glands are essential for normal life and development, reaction to stress and illness, and children who are born with this condition are in danger of sudden death if the disease is not diagnosed and properly
It was
treated.
about a year and a half. She would get sick every single month. And finally, I had enough was enough, and I took her to Children's Hospital, and that's when we found out that her med levels were way off. February 8th, 1995, she got a stomach virus, what we thought it was. And later on that night, she was shaking really bad. We took her into the emergency room at a hospital in New Jersey, and the endocrinologist there met us there and told us to wait in the waiting room. We were there for about an hour. Then he came back in and told me that she was brain dead and that there was nothing that they could do.
Parents are overwhelmed when they find out that their newborn has a disease, any sort of disease. And for the most part, people have not been aware of this disease. It's fairly common, but it's not an everyday language and literature the way, say, heart disease is, high cholesterol, strokes. These are adult diseases. Childhood diseases people find out about because their newborn has been screened for one of these diseases, and unfortunately they're left having to grapple with this with very little information, scrambling around to find out what this involves.
We had just moved to New Jersey from Massachusetts, and were thrilled when we found out that just about 10 minutes from our house at that point in time, there was a CARES Foundation, and there was Kelly Light, and there were these other people who knew about CAH. So it was just a wonderful feeling.
CARES Foundation campaigns for CAH awareness and education. We promote newborn screening for CAH so that babies need not die because of a misdiagnosis. We fund research for better treatments and provide a place for affected families to go for help and to find comfort in knowing that they are not alone. But we have so much more to do, and we need your help to do it. As the only organization in the U.S. dedicated entirely to the CAH community, we need to continue building awareness. We need to fund more research for better treatments and perhaps someday a cure. And we need to keep fighting for newborn screening so that every baby has an equal chance for prompt diagnosis and a healthy start in life. Please make a generous donation so that we can make access to the best care for CAH available to all who are coping with this devastating disease.